Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or the guests are their own. Enjoy the show. Welcome to MS&Me Interviews. I am your host, Erica Lyons Richardson. This week we conclude our series focusing on some of the research and MS treatment innovation presented at ECTRIMS 2018, held in Berlin, October 10th through the 12th. For a quarter of a century, ECTRIMS has served as Europe's and the world's largest professional organization dedicated to the understanding and treatment of multiple sclerosis. The ultimate goal of ECTRIMS is to improve basic and clinical research and clinical outcomes in MS. For those in the U.S., there is a sister conference, ECTRIMS, for which MS&Me Media was pressed earlier this year. In the interest of keeping our show patient-friendly, I will do a short summary of some of the top MS research presented at ECTRIMS. 3 days of mounds of science compressed into an easy-to-understand review from a patient perspective. So let's get started. Our first topic, is there a diet that helps MS? We've been hearing this for years. So many books have been sold and lecture fees collected for how an MS diet of some type or other stops someone's MS activity. The problem has been recreating this result in other patients without the chemo, HSCT, or intensive PTOT the authors also had received. There have been great trials like the recent one with the National MS Society in cooperation with Dr. Terry Walls. What they were able to show was that her diet did lower fatigue in the majority of the patients. This year at ECTRIMS, several more abstracts were presented on diet studies. We've all heard about the benefits of the Mediterranean diet. This emphasizes plant-based foods like fruit and vegetables. Dr. Ilana Katz-Sand and colleagues at Mount Sinai Hospital in New York City randomly assigned 36 women to this diet or educational seminars. Those on the diet received training with a nutritionist and attended monthly meetings to promote adherence. Only one person ended up dropping out of this 6-month study, and the participants reported that they were able to stick with the diet. Preliminary results showed that some improvement in fatigue and quality of life. We need larger studies to see whether MS symptoms can be managed using the Mediterranean diet, but this small study show how feasible these studies can be. This was on abstract P643 at ECTRIMS. Now, ketogenic diets are high-fat, low-carbohydrate diets that have been shown to actually battle inflammation, similar to what happens during the course of MS. Dr. J. Nicholas Breton and his colleagues from Virginia and Canada enrolled 20 participants with relapsing remitting MS. A trained dietitian taught them how to adhere to a modified ketogenic diet. Their adherence was monitored daily by testing ketone levels in their urine. Fatigue, depression, and body mass index, which is an indirect measure of all body fat, all improved after 3 months of dieting. Inflammatory molecules that are secreted by fatty tissue were reduced. Studies like these are what we need to eventually develop evidence-based dietary lifestyles that may benefit people with MS. This presentation was on abstract P958 at the Congress. There are many ways to go about studying diets, although it doesn't have the same statistical power as a controlled trial. Evaluating questionnaire results can allow researchers to involve more people. So Dr. Catherine Fitzgerald and colleagues at Johns Hopkins University in Baltimore analyzed data from a group of 277 people who answered more than 100 diet questions. They were assessed for neurologic function. Their findings were that the participants with the best scores in diet quality had significantly higher processing speeds or cognition and faster walking speeds than those with the lowest diet quality scores. This abstract was presented on P364 at this year's ECTRIMS. So the question, was asked of the president-elect, and the programs chair of ECTRIMS earlier this year when I was in a press session with them. They all agreed that a heart-healthy diet, low in salt and sugar, was the best diet for someone with MS, at least for what information we have at this time. So in other words, maintain your overall health with a good, heart-healthy, reasonable diet. That's the best information we have at this time, because there haven't been wide sweeping controlled studies of this to the point that they could call it, really scientific. So, we've had these smaller groups, as you've seen, and then we'd have the ones that were surveyed, a larger group that was just surveyed on their habits. So they really need to find a way to control a study, which will be difficult, to get us more information on diet. But with more information coming out at ECTRIMS, as you heard on my previous episodes in this series, there is more information coming out on like salt intake and vitamin D levels and everything else. There was more environmental factors impacting MS. So it is coming, and those changes are being seen in the world of MS research. Our next topic is higher body mass index is associated with greater brain gray matter loss in MS. Multiple sclerosis patients who have a higher BMI, body mass index, are more likely to have reduced gray matter volume, researchers reported there at ECTRIMS. The reduction in the brain gray matter is relevant since gray matter volume loss, it actually portends to a greater long-term disability. Okay, so this was reported at the Congress by Ellen Mowry, Dr. Ellen Mowry. She's an associate professor of neurology at Johns Hopkins University Precision Medicine Center of Excellence for MS in Baltimore. And in her oral platform presentation, she also discussed further how that actually, correlated with the lower scores for gray matter loss. So that is a big change in research. It's more focused, on our overall health, BMI, diet. So this is very interesting information that we haven't had a lot of previously. Now, as a companion part of this study, Dr. Mowry looked at whether loss of brain gray matter volume correlated with levels of vitamin D, but then she found no significant association. So sometimes they get surprising results with that. Dr. Mowry and her colleagues reviewed the data from EPIC. This was a 5-year-long study begun in 2004 at the University of California, San Francisco, UCSF. The researchers enrolled adult participants, mostly from UCSF MS Center, with MS and or clinically isolated syndrome with expanded disability status scale scores of less than 8. The patients provided a blood sample and had a clinical evaluation and a brain magnetic resonance imaging scan, an MRI, performed annually. The brain volume measures were determined using the structural image evaluations. The study included patients who had relapsing remitting multiple sclerosis or clinically isolated syndrome with at least one follow-up visit. BMI was calculated from the self-reported height and weight. It was measured at baseline and then subsequently self-reported. Commenting on the study, Dr. Maria Pia Amato, an associate professor of neurology at the University of Florence, Italy, and the newly elected vice president of ECTRIMS, told Neurology Today in the news conference that the change in brain gray matter volume associated with increasing BMI could be related to adipose tissue causing increasing inflammation in the body. But really, this is all speculation, she said. We do not know the true mechanism of action. And she added that smoking and vitamin D, among other factors, are hypothesized to affect MS. We do know that the higher BMI in adolescent girls is associated with an increased risk of developing MS. We can see from these last two topics and from our previous episodes that diet, fitness, salt intake, avoiding cigarette smoke, and vitamin D all play a role with the gene mutations responsible for MS. So our environment, the things we take in, how we take care of our overall health is now, becoming part of the larger picture of MS. Yes, MS is caused by the over 200 gene mutations, and it's expressed in our RNA proteins. However, as we can see, this environmental trigger that we've all, heard of since we started learning about MS does play that large factor in how it's triggered in our body, who among those carrying those gene mutations have the disease triggered, and how we can possibly avoid those triggers by being really careful with our BMI, avoiding some of those triggers like cigarette smoke. And of course, Epstein-Barr virus is kind of hard to avoid because it's so common, but there are some factors we can avoid, watching salt intake and things like that. So there are ways to even protect our children who might be carrying, gene mutations for MS. Our next topic is the evobrutinib was seen to lower active brain lesions in phase 2 of the trial. Merck announced that the evobrutinib in its oral candidate for relapsing remitting MS was able to safely and significantly reduce active brain lesions over 24 weeks of treatment. This according to the results of the phase 2 study sponsored by the company. Evobrutinib is an investigational oral inhibitor of BTK, which is a signaling protein believed to be important for the proper development and functioning of a number of immune cells, including the all-important B cells and macrophages. In the double-blind randomized study, the placebo-controlled phase 2 study, the therapeutic effectiveness of low, which is 25 milligrams once daily, mid, which is 75 milligrams once daily, and high, which is 75 milligrams twice daily, doses of this medication were compared to the treatment Tecfidera, or a placebo, of course, in people with relapsing MS. The evobrutinib at 75 milligrams, either given daily or twice daily, was seen to significantly reduce the number of active brain lesions, referred to as T1 lesions on the MRI, at weeks 12, 16, 20, and 24 when they compared it with the placebo. The mean number of active lesions in patients taking this new medication at 25 milligrams once daily, 75 milligrams once daily, or the 75 twice daily, dropped as the dose rose, so respectively at the 12 to 24 weeks. In the placebo group, the mean number of active lesions was 3.85. Such results suggest that the evobrutinib's therapeutic effect has a dose-response relationship, with a 75 milligram daily or twice a day dose leading to a significant benefit, but not the 25 milligram. That didn't work out. So the mean number of lesions at 75 twice a day was 2.19 in the patients, 3.14 in those on 75 once a day, 6.52 on the 25, and then 5.96 in the placebo group. So you can see how that was a significant difference. The data is not yet available on the full 48-week treatment or comparing the effects of the treatment with Tecfidera versus the ibrutinib or Tecfidera versus placebo. So we'll be waiting for that information to come out to see how, this is going to develop over the course of the full study of this medication. But it is looking like it will be a significant difference in lesion volume at that higher dose. So we'll be looking for the follow-ups in this study. And of course, we'll bring that to you on MS&Me Media when that comes out. Now, our next topic is additional analysis on the ozanimod demonstrate that its potential to treat relapsing MS. It continues to demonstrate a benefit to patients with relapsing remitting MS. So that's who's in the study. Of course, we rarely see the SPMS or the PPMS patients, unfortunately, included in many of these studies. However, we have reported on several here during the course of this review. Findings from the Phase 3 Sunbeam and Radiance Part B trials were discussed there at ECTRIMS. The ozanimod is an oral available compound designed to inhibit the migration of immune cells involved in the inflammatory process that promote the damage to the nerve fibers and to the myelin sheaths that protect them. That's the hallmark of MS. The Sunbeam study enrolled 1,346 patients with relapsing MS. They were randomized to receive once daily either the 0.92 or the 0.46 milligram ozanimod and equivalent to 1 milligram and 0.5 milligram of the ozanimod HCl formulation, or that once weekly intramuscular injection of their approved therapy, Avonex. So for at least 12 months. Previous results showed that the ozanimod could reduce the relapse rate and the number of brain lesions in these patients. Now, a post hoc analysis of the data revealed that treatment with the ozanimod for a year could promote significant changes in patients' cognitive processing speed compared to the Avonex. So this is new information. Ozanimod treated patients showed a 1.6 point change and a 1.2 point change with the 1 milligram and the 0.5. So depending on which of those doses you were on. Now, as determined through the symbol digit modalities test, so it's called the SDMT. Also, more patients with that experience the clinically meaningful improvements in processing speed, as assessed by that 4-point or higher improvement in the SDMT, upon the treatment with the ozanimod than with the Avonex after that year of treatment. So slowed cognitive processing, which is common in multiple sclerosis, often impairs the quality of life for people living with this disease. The findings from these new analyses suggest that when compared to the interferon Avonex, ozanimod has a beneficial effect on that processing speed, so an additional benefit besides preventing those lesions. Results showed that treatment with the higher and lower doses of ozanimod reduced by 42 and 26% respectively the annualized relapse rates compared to the Avonex, while approximately 96% of the confirmed relapses required steroid treatment or hospitalization. Treatment with the investigational agent, the ozanimod, was found to reduce relapses requiring such approach. So in addition to the portion of the ozanimod treated patients with relapses requiring steroids or hospitalization, it was 20.2% 0.1% and 23.3% in the higher and lower dose groups, whereas Avonex groups, they required that 30.7% of the time. So all these data supported the potential of ozanimod as an effective oral treatment to reduce the relapse rate and the severe relapse rate, the severity of that relapse rate in patients with relapsing MS. So that was a very good result that was presented at ECTRIMS this year. Now, this brings us to the end of our ECTRIMS review 2018. There's so much more data we could have brought you. There's just mounds and mounds and mounds of it, as we stated, but we kind of wanted to do the highlight of the largest studies that were coming out, some of the most talked about information that was presented at this year's ECTRIMS in Germany. It was a wonderful congress. It really was. There were so many people there and so many great presentations. And I really urge you to follow the ECTRIMS website, the ECTRIMS website, which is the America's version of the Congress, and really follow the research for yourself. Become your own care advocate by arming yourself with this information. It helps you better make decisions. You know, your doctor can recommend the next treatment choice for you, give you several choices to choose from, but it's going to be up to you to go beyond just reading the pamphlet from the manufacturer, because those warnings on there, the side effects, those are all reported through these phases of these trials. And they have to report by law, like for FDA approval, they have to report everything the patients, experience during the trials, whether related to the drug or not. Even if they come up, with information after the trials with further study, that these weren't actually related directly to the medication, they're still there on that warning label. So, it can scare you off from what could be a good treatment for you. But studying all of the information that you can get through the physician's copy of the medication pamphlet, and then learning to read all these studies that come out and the follow-up studies, learning to follow ECTRIMS and ACTRIMS reviews by many different wonderful doctors and reporters from MS associations, you can really start making these decisions on your own, well-educated decisions on what might be your next best step. So I really do encourage everyone to do that. So if you followed our series, it's really become clear that we're living in a very hopeful time for MS. Scientists are identifying the genetic process and environmental factors involved in MS. They are also learning ways to slow the disease progression, turn off processes and reverse damage, allow the body to remyelinate itself by, suppressing that disease activity long enough. Trials are becoming more inclusive of progressive patients and patients with higher EDSS scores, as in with one of the studies we were discussing. Patients anxiously await to see these new treatments that are in trial. And they are becoming more emboldened to discover these things for themselves and join patient forums and share this information and really arm themselves. And another tip that I would like to leave with you before we close for this review is that, you might want to always bring a loved one or friend with you as your additional advocate. Even if you feel like, I'm still, capable of advocating for myself, it never hurts to have another set of ears and eyes there at those appointments. They might catch something that you missed because you were thinking of the next thing you wanted to ask your doctor about, and you might miss something your doctor told you to do or had recommended you research, or they might remind you of a symptom you forgot to share with the doctor, something you were experiencing that they noticed that you didn't even realize yourself. So it can be very helpful to take a care partner like that to your appointments. So I really wanted to leave that with you. And of course, there's wonderful apps out there now. There's wonderful tools that we can employ. I like to use my good old phone, alarms on my phone, and the note section on my phone. And I, make sure that my caregiver has that. And they sit there and read that to my doctor at my session. So I don't forget to ask one of those questions or share a new symptom or issue I'm having, or that something's increased or decreased. I want to make sure that all that is shared during that appointment so nothing's missed. Because sometimes care decisions can be made on the information that we share. So keep arming yourself with information, tons of information. You can get more information on our website at www.msandmemedia.com. That's msandmemedia.com. And of course, you can always listen to our 24-hour MS network here. On this network, we will continue bringing you more research and more interviews each week. We will continue our series later this year of bringing you more perspective from MSers living, with MS every day. So letting them share their stories with you. So you might find something that you have experienced, and you will find that understanding you've been looking for. We'll also, of course, keep interviewing the top experts from around the world. We'll bring that information here for you on MS&Me interviews. Thank you again for joining me this week, and it's been a pleasure to share with you all this information from ECTRIMS. The Congress, like I say again, was wonderful this year, and looking forward to the next ECTRIMS. So ECTRIMS Congress is coming up in 2019, and MS&Me Media will be sure to bring you all of that information. Thank you so much, and have an amazing week.